Okay, so you ready? We're going deep on meth overdose today.
Yeah, it's a big one.
Yeah, we got research like piled up here, and
Yeah,
it's pretty heavy stuff.
it's really serious.
Yeah. So for anyone who might not be totally up to speed, um, what exactly is meth? What is it about this drug that makes it so dangerous?
Well, methamphetamine, we shorten it to meth. It's a powerful stimulant that really messes with your central nervous system. And it's not like just your body's going into overdrive, but your brain is too.
Hmm.
We're talking about this white crystalline powder, and it can be snorted or smoked, even injected.
Oh
And
wow.
each of those methods has, its own unique set of risks.
Hmm. Interesting. Okay, so we've got info here about both acute and chronic overdoses.
Right.
And I got to admit, I'm not really sure what the difference is between those two. Can you kind of break that down for us?
Yeah, so acute overdose is, I think, what most people think of when they hear overdose. It's a sudden massive dose that your body just can't handle at all.
Right.
And it can happen to anyone, but new users are especially at risk because they don't have any tolerance built up.
That makes sense. So if acute overdose is, like you said, that sudden slam on the brakes,
Mhm.
what's chronic overdose like then?
Chronic overdose is more like you're slowly draining the battery in your car.
Yeah.
It's the result of using meth over and over again, and it slowly damages your organs and your body's systems over time, and then eventually something just gives,
Yeah.
and the consequences are really bad.
And then you add on top of that the whole street meth problem where you really just don't know what you're getting.
Exactly.
It just makes it
Yeah, street meth, it's not regulated,
right.
so you really don't know how pure it is, how strong it is, and it could be mixed with all kinds of stuff. Some of it's harmless, but some of it could be super dangerous, and you would
Mhm.
never know until it's too late. Imagine if you went to the gas station and you weren't sure if you were putting premium gas in your car or something that would totally ruin your engine.
Right.
That's kind of the risk with street meth.
Yeah. That's a scary thought. Okay, so let's get into symptoms. If somebody is overdosing on meth, what should people be looking for?
Well, the signs can vary. Everybody's different and they react differently. But some things that are pretty common are like a lot of sweating, their heart's beating super fast.
Hmm.
They might seem really confused and they might have trouble breathing.
We've also got some info here about more severe symptoms like seizures and chest pains and even like changes in skin color.
Yeah.
It's,
It can get really intense.
yeah, for sure. And what makes it even trickier is that sometimes the symptoms of a meth overdose can look like other things too,
Oh, yeah.
like a panic attack or a heart problem.
Absolutely. And that can cause delays in getting the right help because people don't realize what's actually happening.
Right. So it's not always clear cut.
Right.
But what are some of the most common causes of a meth overdose? Is it just taking too much at once, or are there other things going on?
It's almost never just one thing.
Yeah.
A huge dose can obviously cause an overdose, but there are a lot of other things that can really increase the risk too.
Like what are some things that make somebody more likely to have a bad reaction to meth?
Well, one big one is mixing meth with other stimulants like cocaine,
Oh, yeah.
amphetamines, even ecstasy. Think of it like throwing gasoline on a fire.
Wow.
Your heart and nervous system just can't handle that kind of stress.
And then we've got the whole issue of mixing meth and opioids too,
Mm.
which seems to be more and more of a problem these days.
It really is. And it's a super dangerous combination.
Hmm.
Opioids like fentanyl, they're depressants,
Right.
and meth is a stimulant. So you're mixing these two things together,
Hmm.
and it creates a really unpredictable situation.
Right.
Like the effects of one drug can actually mask the effects of the other one.
No.
A study came out recently in the Journal of Addiction Medicine, and they found that people who mix meth and opioids are 5 times more likely to overdose fatally.
5 times.
Yeah, 5 times more likely than someone who's only using meth.
That's alarming.
Yeah, so somebody might think they need more meth to get high, but they don't realize they're already on the verge of an opioid overdose.
So they could be overdosing on the opioid and not even know it
Yeah.
because the meth is masking the effects.
Exactly. And what's even scarier is that sometimes fentanyl is actually used to cut meth because it's cheaper and it looks really similar.
Well,
So people might think they're getting pure meth, but really they're basically playing Russian roulette with a potentially deadly dose of fentanyl.
yeah, that's heavy stuff. So besides mixing with other drugs, what are some of the other things that make someone more vulnerable to an overdose?
Oh, there's a lot. Genetics play a role.
Oh, okay.
Pre-existing health conditions, even your environment can make a difference.
Really?
Yeah, like if you have a family history of addiction, your risk is higher.
Hmm.
And even the way you take the drug matters. If you inject or smoke meth, it gets into your system way faster
Okay.
than snorting or swallowing it.
Right.
And that makes an overdose more likely.
So it's kind of like the difference between slowly sipping a drink and chugging the whole thing down at once.
Exactly.
Your body just can't process it that fast.
You got it. And that's why it's so important to understand both the short-term and long-term effects of meth use.
Okay, so let's talk about those effects.
Mm.
What happens in the immediate aftermath of taking meth? What kind of short-term impacts are we talking about?
Well, at first, somebody might feel really euphoric and have a ton of energy
Yeah.
and be super alert.
Mhm.
They might start breathing really fast. Their heart will be racing. But those things that seem good at first can quickly turn into something more dangerous.
Right, like agitation, anxiety, even psychosis. It's like a roller coaster ride that takes a really bad turn.
Yeah, that's a good way to put it. And those immediate effects are bad enough. But the long-term consequences of meth use are truly devastating.
So what kind of long-term damage does meth do to the body? What are we looking at here?
It's a long list,
Yeah.
and it's pretty heartbreaking. Meth can really mess with your cognitive abilities. Like your memory and concentration just go downhill.
Hmm.
It can cause mental health issues like anxiety and depression, and even long-lasting psychosis with paranoia and hallucinations.
We've also got research here about organ damage, especially to the liver, the kidneys, and the heart.
Yeah.
And then there's the risk of bloodborne infections like hepatitis and HIV from sharing needles.
Yeah, you're hitting all the major points. And we can't forget about the damage meth does to the intestines, which can lead to serious complications,
Oh, wow.
like peritonitis, which is an inflammation of the lining of your abdomen,
Okay.
and even septic shock, where your body's response to an infection can lead to organ failure.
Wow.
It's really insidious how meth attacks the body on so many different levels.
Yeah, it's clear that meth overdose is a really serious and complicated issue. But what happens when somebody does overdose?
Mhm.
What can be done about it? And how can we prevent this from happening in the first place?
Those are the key questions, and that's exactly what we're going to get into right after this break.
So before the break, we were talking about the long-term consequences of meth use. And it's clear that this drug can have a really, really devastating impact on the body. But I want to kind of shift gears here and talk about what happens when somebody's actually in the middle of a meth overdose. Like, what can be done?
Well, the first thing to remember, and this is super important, is that a meth overdose is a medical emergency.
Right.
Like every second counts, so you got to act fast.
So calling 911 is the obvious first step.
Absolutely. Get those emergency medical professionals on the scene as quickly as possible.
Okay.
That's the best chance for a positive outcome.
Okay. That makes sense. But once they get there, what do they actually do? Like, how do they stabilize someone who's overdosing?
Well, it really depends on, how bad the overdose is and how the person's reacting.
Right.
But there are some common interventions, like they might give them something to calm them down, for the agitation and anxiety.
Mm-hmm.
And there are medications to control seizures and get their heart rate and blood pressure back to normal.
We've also got some information here about cooling the body.
Why is that so important in a meth overdose?
That's a really good point. Methamphetamine can cause your body temperature to spike way too high. It's called hyperthermia.
All right.
And if it's not treated, it can cause organ damage and even death.
Wow.
It's like your body's going into overdrive, and
Right.
overheating like an engine.
Right.
So the medical team's going to use things like cooling blankets and ice packs to bring that temperature down as quickly as possible.
So it sounds like treating a meth overdose is a pretty intense process with a lot of different moving parts. But let's talk about prevention for a minute.
Yeah.
What can people do to protect themselves and the people around them from the risks of a meth overdose?
Well, the most effective way to prevent a meth overdose is to just not use meth at all, to abstain.
Right.
But we know that that's not always realistic, especially for people who are already struggling with addiction.
Right.
So harm reduction strategies are super important.
You mentioned harm reduction. What does that mean exactly in this context?
Harm reduction is all about trying to minimize the risks associated with drug use.
So, for example, one of the biggest things someone can do is to never use meth alone.
Mm-hmm.
That way, if something goes wrong, there's somebody there who can call for help.
Right.
It can literally be the difference between life and death. And it's also super important to know the warning signs of an overdose.
Right.
Like we talked about earlier, the extreme agitation, confusion, sweating chest pain, a racing heart. If you see any of those signs in someone who's using meth, you got to call 911 right away.
So knowing the signs and having somebody around who can call for help, Those are two key harm reduction strategies.
Exactly.
But let's say somebody does witness a meth overdose.
Hmm.
What should they do in those moments while they're waiting for the paramedics to get there?
That's a really good question. In a situation like that, the most important thing is to stay calm and act quickly.
Okay.
First, you got to assess the situation. Is the person breathing? If not, start CPR right away.
Right.
If they are breathing, but they seem to be overheating, try to cool them down with cold compresses or a fan. And if you think that opioids might be involved, you should give them naloxone if you have it.
Naloxone or Narcan.
Right.
That's the medication that can reverse the effects of an opioid overdose.
Exactly. It's becoming more and more common to find fentanyl mixed with street meth. So it's always a good idea to have naloxone on hand and know how to use it. It could literally save somebody's life.
That's a really good point.
Yeah.
But I'm guessing naloxone wouldn't do anything to counteract the effects of the meth itself, right?
You're right. Naloxone only works on opioids. It doesn't reverse the effects of the methamphetamine. So even if you give somebody naloxone, it's still super important to get them professional medical help as fast as you can.
So call 911, give them naloxone if necessary, and try to keep the person cool and safe until the paramedics arrive. What else can bystanders do to help in those critical moments?
Giving as much information as you can to the 911 operator can be really helpful. Tell them exactly what drugs were taken, how much was taken, when it was taken, and all the specific symptoms the person's having. The more details you can give them, the better prepared those emergency responders will be to give the right treatment.
It sounds like knowing what to do and what information to provide in those moments can make a world of difference. But at the end of the day, the most effective way to address this whole issue of meth overdose is to deal with the root of the problem, which is addiction. What kind of treatment options are out there for people who are struggling with meth dependence? Where can they go to get help?
Well, luckily, there are a number of evidence-based approaches that can help people break free from meth addiction. Detox is often the first step.
Yeah.
It involves medically supervised withdrawal to help manage those intense cravings and discomfort that come with quitting meth.
So detox is the first step. What happens after that? What kind of long-term support do people need to stay on the road to recovery?
That's where behavioral therapies come in.
Okay.
These therapies help people address the underlying thought patterns and behaviors that contribute to addiction. Right. Cognitive behavioral therapy. CBT is one that's really effective.
We've also got some research here about dialectical behavior therapy, DBT.
Right.
How is that different from CBT?
That's a great question. Both CBT and DBT can be super helpful in treating addiction,
Okay.
but they do have different focuses. CBT helps people identify and change the negative thought patterns and behaviors that are contributing to their addiction. And DBT focuses more on developing emotional regulation skills and coping mechanisms to deal with stress and triggers that can lead to relapse.
So CBT is more about changing thoughts and behaviors, while DBT is more about managing emotions and coping with triggers.
Exactly. DBT is especially helpful for people who struggle with intense emotions and self-destructive behaviors, which are common in people with meth addiction.
So it's not just about therapy either.
Yeah.
Right. I understand there are other approaches that can be helpful in supporting recovery, like holistic therapies.
You're absolutely right. Holistic approaches like yoga and meditation and even equine therapy can play a really valuable role in supporting overall well-being and recovery.
Interesting.
These therapies can help people connect with their bodies, manage stress, and develop a sense of peace and grounding, which can be so helpful in the recovery journey.
It sounds like taking a multifaceted approach is key, addressing the physical, emotional, and psychological aspects of addiction. But how do people even begin to access these different treatment options? Where do they go for help if they or someone they know is struggling?
That's a crucial question, and it's something we'll explore in more detail after Quitter.
So we were talking about all these different ways to treat meth addiction, and it sounds like there are a lot of options out there.
Yeah, there are.
But I imagine it can still feel really overwhelming for someone who's struggling, and they don't know where to turn. What would you say to someone who's in that position?
You're right. It can be really daunting to even think about asking for help. But I think the most important thing to remember is that you're not alone.
Yeah.
There are people who care and people who want to help.
Absolutely.
And taking that first step is often the hardest part, but it's the most important one.
So what does that first step actually look like? Where can somebody go to find that initial point of contact?
Well, it's different for everyone. Some people, it might be reaching out to like a doctor or a therapist or a counselor.
Right.
For other people, it might be talking to a friend or a family member, somebody they trust.
Right.
There are also a lot of really great helplines and online resources specifically for substance abuse,
Oh, okay.
like the Substance Abuse and Mental Health Services Administration, SAMHSA.
Okay.
They have a national helpline. It's 1-800-662-HELP.
Got it.
And they offer 24/7 support and can give you referrals to local treatment centers.
That's great. So when somebody has reached out for help, what's next?
Mhm.
How do they go about finding the right treatment program?
Finding the right program is super important, and there's no one-size-fits-all approach to recovery.
Right.
Some people might need inpatient rehab where they live at a facility and they get really intensive therapy and support in a very structured environment.
Okay.
Other people might do better with outpatient programs, which are more flexible, but they still provide structure and accountability.
Mhm.
It really just depends on the individual's needs and their situation.
You mentioned Rolling Hills Recovery Center earlier. Could you tell us a bit more about their program and what makes their approach to treating meth addiction unique?
Yeah, Rolling Hills is a great example of a facility that takes a really comprehensive and individualized approach to treatment.
Okay.
They understand that addiction isn't simple.
Right.
It
Right.
has physical, psychological, and emotional components. So their program addresses all of that.
Wow.
They don't just focus on the physical withdrawal symptoms, but they also help people understand the deeper reasons why they're addicted in the first place.
So they go beyond just treating the physical symptoms and actually try to get to the root of the problem.
Exactly. And they offer a range of evidence-based therapies like the CBT and DBT we talked about earlier.
Right.
Plus, they incorporate holistic therapies like yoga and meditation and art therapy and even equine therapy.
Wow, that's interesting.
Yeah, these therapies help people connect with their bodies, manage stress, process trauma, and just develop a sense of peace and grounding.
It sounds like they offer a really well-rounded approach,
Yeah,
combining traditional therapies with these more alternative approaches to create a truly personalized experience.
they do. And another thing that makes Rolling Hills special is their focus on community. They have group therapy sessions, family counseling, and alumni programs,
Oh, wow.
so people can connect with others who really get what they're going through. Recovery is a journey, and it's a lot easier when you have a support system.
That's a really powerful message, that recovery is possible
Absolutely.
and that there are resources available and that no one has to go through this alone.
Right.
As we wrap up this deep dive into meth overdose, is there any final takeaway you want to leave our listeners with?
If I could just leave everyone with one thing, it's that addiction is a disease. It's not a moral failing. And like any disease, it needs treatment, compassion, and understanding. There's hope for recovery, and you don't have to fight this battle by yourself. Reaching out for help is a sign of strength, not weakness.
That's so important to remember. If you or someone you know is struggling with meth addiction, please know that there are people who care and there are resources available and there's a path toward a brighter future. Stay curious, stay safe, and remember, you are not alone.